Today we're going to discuss the prevalence and effect of fake news and misinformation. First of all, what is misinformation? Misinformation is defined as false information that is spread regardless if there is intent to mislead. This definition is important since misinformation can be spread passively. Fake news can be spread regardless if there is malicious intent or not, if the audience believes the information. Because of its prevalence in today's society, it was deemed 2018's Word of the Year. We live in the age where finding and sharing information is the easiest it has ever been in human history, especially when it comes to health and medicine. However, the information found on the internet and many social media sites are inaccurate, which makes it potentially dangerous. The viral nature of misinformation has become a significant threat to public health. This has become evident in relation to vaccines and anti-vaxxers, which has resulted in the re-emergence of communicable diseases. Homeopathy and naturopathy, which have a large social media audience, often discourage people from seeking appropriate medical care for their health issues. Other concerns include fad diets that can be found online that has unhealthy adverse effects. Meet Andrew Wakefield. In 1998, Andrew Wakefield, who is now known as a discredited British ex-physician, was an anti-vaccine activist who published a paper claiming that there is a direct link between measles, mumps, rubella vaccine, and autism. Although this information has been discredited a multitude of times by the scientific community, it still continues to be a prevalent concern in the medical community today, since a significant number of parents are opting out of vaccinating their children as a result of fear that vaccines might cause them to develop autism. According to the CDC, measles were considered to be eradicated in the United States in the year 2000. In 2015, there were reported 147 cases of measles as a result of an outbreak at the Disneyland theme park in California alone, which in addition affected multiple surrounding states. In addition to the Wakefield study, popular pop culture figures' belief, whether it's true or false, seem to have a profound health effect on society's health behavior and decision-making today. This is particularly of importance in recent history when it comes to vaccines. Popular celebrities such as Jenny McCarthy, Jessica Biel, Jim Carrey, and even President Donald Trump were all vocal about anti-vaccine messages, thus increasing the rates of anti-vaxxers, resulting in the return of communicable diseases. What are some common myths surrounding vaccines? The first myth is that vaccines cause autism. The fact is, vaccines do not cause autism, and the fear was derived from the discredited Wakefield study. At the time it was published in the prestigious medical journal The Lancet, the hypothesis was taken seriously and there have been many studies conducted. The studies found 0 links to indicate that the measles, mumps, and rubella vaccine causes autism. The cause of autism is still unknown today, and many studies indicate that it develops in utero, which is long before the vaccine is even administered. Myth number 2. Infant immune systems cannot handle numerous vaccines at a time. However, the fact is, infant immune systems are strong, and basing it on the number of antibodies present in the blood, theoretically, infants are able to handle 10,000 vaccines at a time. Myth number 3. Vaccines aren't worth the risk. The fact is, despite the concerns of many parents, for decades children have been vaccinated successfully, and there have been no credible research study conducted that links vaccines to any major health concerns. Myth number 4. Vaccines will cause the child to develop the disease it is trying to prevent. The fact is, this is a common misconception because although vaccines may cause mild symptoms resembling the disease it is trying to prevent, it will not cause the disease itself. Myth number 5. No need to vaccinate children in Canada and the US because disease rates are low. The fact is, disease rates are low because of herd immunity, which indicates that when a large population of people are immunized, even the unimmunized minority will be protected, which will never allow the disease to establish itself and spread. A recent approach that has been shown to be effective is to contact the influencers of social media, requesting for them to share useful medical information content with the followers of their platform. Recently, Facebook has publicly joined in the efforts. From the public health level, public health organizations will need to improve and increase their presence in social media, which will aid internet users to find information that is accurate. At a clinical level, physicians trying to change the minds of their patients who hold on to potentially harmful misconceptions and health myths will need to have patience, since their patients will not be able to let go of their strong beliefs immediately. Fake news and misinformation, when shared with a large audience, misleads and possesses many frustrating problems for the general population. This usually has a downstream effect on their overall health. If left unquestioned in the context of public health concerns, fake news and misinformation can further undermine acquisition of evidence-based research and public health research efforts from health organizations, which will result in an epidemic itself. The internet, along with social media platforms, have become a major part of our everyday lives and will not be going anywhere anytime soon. People will continue to share and seek information on the internet, which will allow misinformation to persist as well. In an effort to aid in our society living healthier lives, we will need to help them find more accurate, evidence-based health information.